yeah, it was very stressful during the war, I would say. On Indian news, on the first day only, they showed that Russia is going to put a nuclear bomb. It's like, is this FMGE exam or PSM exam? Because so many questions were just from PSM. Every third or fourth question was PSM. Unless you have studied everything, even luck is not going to work for you. So you have to have read it somewhere so that you will, by luck, it will come into your head. So I think some questions might even be from US only also. Even MCQ solving is like an art, and only when you practice it, you will know. If you study only theory for 6 months, even if you have done it 10 times, you won't. I don't think you will be able to clear the exam. Recalls whatever students give, but it doesn't match the actual exam. I must say that after the exam, I watched recalls a lot because I was stressed. So even though I thought they were not correct, I was still watching them out of compulsion.
So before entering into the podcast, let me introduce my today's guest, Dr.Tejas, who has also cleared his FMGE Jan 2024 in his first attempt with 193 marks. And the reason of inviting him on this podcast is that because he has graduated from Crimea and it was a heavy war zone. Against all odds, he cleared his exam. So let's get into the podcast. So over to you, Tejas. Tell your university name and other formal details.
So I completed my MBBS from Russia in Crimean Federal University, which is in Crimea. And it was a 6-year course. And I think I met Chinmay for the first time in my second year.
Yes.
And it was basically a Russian language competition where I met Chinmay.
So what happened in 2018, I guess, there was a Russian Olympiad in a university. Crimean State Medical University was invited, and he was one of the guests among that, and he came to Russia to Kazan, and I was his tour guide also for like 2.5 or 3 days. And there were a panel of 3 judges in front of us in Russian competition, and they were asking questions in Russian, like why all Indian want to do MBBS from Russia, and I was the one who answered the thing because we want to earn a lot of money, and I was like, whole panel laughed at me. And it's very difficult to earn money being a doctor, because now we came to know it, because still it's like 6.5 years and we didn't earn our first salary yet.
Yeah, I think it was a crazy experience because for the first time I came to Kazan, and it's such a big city because when I studied Simferopol in Crimea, it's pretty small, and it's like a small city. And when I came to Kazan, it was kind of like Mumbai. It was like a huge city, and so many things happening, so many different kinds of people there. It was a very crazy experience. Different language also. I think there they speak Tatar also, apart from Russian. So it was pretty crazy to listen to everything.
So let's move on to the first formal question. Tell me something of preparation days during last 6 months of FMG, as well as a few preparation tips during 6 years of your study at Crimea, because there was a war situation and you got your degree during the Russia-Ukraine war was going on, and still it's going on. So how was that experience? Because in between we had a talk with you also, you said I'm seeing the trucks of army camps are going nearby me, and I don't know what's happening in my city because everything is closed, internet is closed, and it was a havoc. So you can share that.
So I think with respect to preparation tips, I think the biggest one would be is to study for the classes and not take any reworks. I think that's the biggest tip that I can give. If you want to clear FMG in like a very easygoing way and not take stress in the last 6 months, then it's better to start studying from the first year itself, because there are some things that you can learn only in university. You can't learn through coaching classes, right? Because teachers are in front of you, they are doctors as well. So the things they teach you is very different from what you learn in coaching classes and online apps. So just keep studying for every class. You don't have to study 10 hours every day in university. You can enjoy also. Everyone enjoyed.
Yeah.
But just because during classes you have only 10-15 pages maximum to study, right?
Yes.
So even if you just look over them and see what material is there in the class, then whatever the teacher is telling you also gets into your head faster.
Okay.
Otherwise, you're just sitting clueless, and the whole year will pass by, and you will not realize what happened with you. And during the exam, it's complete stress.
We also had the same teacher. Like for me, my microbiology teacher at during the university days was like too strict about a subject, and they were like giving us homework every day, like write this back, write about everything, make notes. And we were going with our notes. You were checking like KG student, and that helped me a lot because the few of the stuff still I remember what she has taught, and that was the best thing. And same, I guess, with Tejas was there, and he was also explaining me while he was in Kazan, like our teachers are too strict, man. They were not like, they don't allow us to pass the exam if you didn't do any homework or something.
Yeah, actually, I think in Russia, it's especially in the third year, it's very tough to study because you have 6 major exams, and they are all very difficult subjects, and all the teachers are very, very strict. So even for us in microbiology, we had this small workbook that we had to fill in every class. After doing whatever experiments or anything, gram staining, you have to draw it and write something about the bacteria, virus, and things like that. So our teacher also used to go to every bench and check what we are writing, and she would ask questions to each and every student. And if you don't answer, then that day's class is gone. You won't be credited for that class, and then you have to meet them again on some other day and study and come again. So yeah, it was pretty tough. Third year, I think, was the toughest for us.
Last 6 months strategy, you should tell about that.
I don't know if many people will agree with me, but in the last 6 months, most of the things, I've mainly focused on studying rapid revision and solving the question bank.
Okay.
Because I think when I came back, I knew my core concepts were pretty much clear, so I thought I don't need to study the main videos. But still, after I came back, I think I wasted like 1 or 2 months watching main videos only, because I was in that phase where everyone is doing main videos. I'm the only one who is focusing on like the shortcuts. So I thought that it won't work for me. So I started watching main videos, but after a month I realized that no subject is getting completed. I'm just watching videos every day, and if I continue like this, then I won't even complete the syllabus by the time the exam comes. And 6 months is a very short time. It just flies and you don't even notice. So after I think 1 month of doing main videos, I said to myself that I need to stop now. I started rapid revision only, and if there was some video that I found very tough, especially in subjects like ophthalmology or PSM or ENT, then I would watch the main videos, and even surgery. So if I found some topic tough, then I will watch the same topic main video, and that will mostly clear my doubts, whatever I have. Or if I didn't understand anything, it would clear my concept. So I think that saved much more time. I did use USMLE first aid also, but not throughout the whole 6 months, because at the end I was mainly focusing on the Q bank only and whatever notes I had made from rapid revision. I mean, I had bought the rapid revision notes, so I was highlighting while watching videos or making some extra points in that. So I used those notes only. Main strategy was that anyhow I have to complete this till Jan 1st, everything. And last 10 days I have to do all subjects again. So I have to do preparation in such a way that I should be able to complete all subjects in the last 10 days, because I know that I won't remember anything. Because if I have studied some subject in November, by December, January, it's out of my mind already. By the time I complete the other subjects, the first subject that I did would have been out of my mind already. So I knew one thing, that in the last 10 days anyhow I have to read all subjects like anatomy, pharmacology, and some pathology, stains and stuff. So I did all those in like the last 2-3 days. Even the PSM, different schemes that the government has, all the schemes and everything I did in the last.
Doing PSM is not a great job. Like doing again and again also, it's of no worth, I guess. I guess because nothing has matched with my notes as well as my preparation while I was sitting in front of the question paper. So it was very vague and different questions, especially numericals, and I guess the schemes also. different name of scheme was there. I guess 1 to 2 questions were there, and I was like, oh, how I will do that? Like, I don't know that.
Yeah, whatever we studied in the notes or whatever list that we had made of important points in PSM, none of those came in the exam. It was something else only.
Yeah.
And while solving also, I'm just like, is this FMG exam or PSM exam? Because so many questions were just from PSM. Every third or fourth question was PSM.
35 or 30 questions were there from PSM. Sure, I will.
Yeah, for sure. And even medicine, I think, was quite a lot because you can't actually distinguish which subject this is from. Everything feels like medicine only because everything was like clinical during the exam. Very clinical, so you can't distinguish, okay, this is pathology or this is medicine.
One more thing I want to ask you, that is how you remembered the like one-liner part, because for me it was difficult. Whenever I have seen the one-liner, like it was like it has blown my mind. So what, like, did you find the same stuff or it was easy for you?
I think some subjects were tougher than the others, but for me, I think pathology, stains and all were much more difficult to study, and even the images, because you are seeing it on an app and not actually in person. So I think even in my university time, I struggled a lot identifying all these stains and pathology images under the slide, because I never used to understand what is happening under the slide, but I kept reading it again and again. So I think 2-3 times at least I must have covered all the stains and pathology in general, so that helped me a lot, I would say. And pharmacology, I like pharmacology, so it was a little bit more easier for me to remember everything. So I think in the last 2-3 days,
you did pharmacology.
But you will get to know that, okay, this one-liner can come or this thing can come. After, if you have studied properly for 6 months, in the last 10 days, your intuition would only tell you that, okay, this topic can come.
I guess I was like, before going to exam, there was intuition, like I thought this diuretics, I was like, sure, one to two questions were there, and it was there, like 2 to 3 questions from diuretic directly came just for like, what is the class of this drug? I was like shocked.
Yeah.
And I made those correct, but few of the questions were really difficult. For example, in surgery, they asked like classification based question, like regarding hernia. Those were really difficult. I guess those were meant to be wrong only, I guess, from my perspective. What about you?
Yeah, I think classification for me also, by hearting everything is very difficult, especially all the breast oncology classifications and different Duke's classification. All these are very difficult for me to remember. It doesn't stay in my head a lot. So I did all the classifications and whatever it was just one day before the exam. And I was like, if I remember, I remember. Otherwise, I will try to eliminate options and select the best one, and then everything is on God.
Okay.
So that was my strategy, I think.
One more question is that, do you believe in luck in this exam? Because a lot of students and a lot of my friends, whenever they meet me and they say, man, you were lucky, you guys were lucky, you passed the exam. So do you think like this? Because personally, I don't think like this. Because even if you like make some questions wrong, then also if you are passing, then it doesn't mean that you are lucky. You mean you have studied. So what's your take on it?
I think luck matters, but it's only like 5% maybe of your whole preparation. It's unless you have studied everything, even luck is not going to work for you. You won't remember things, or you won't recall things randomly out by fluke. So you have to have read it somewhere or seen some video about that topic, so that you will, by luck, it will come into your head. So if you didn't study, then even luck is not going to help you during the exam.
Okay, what's your take on part 1? Because after coming out of the exam hall, like students were talking a lot that it's the easiest part ever in the FMG history, and I was like, really? I didn't think, like, I don't think it was, because there were a lot of one-liners, as well as there were a lot of twisted questions, and of course PSM was the killer in the part 1. So what's your take on that?
First, before giving the exam, I thought that in the first part only preclinical subjects will come, and in the second part only like clinical will come. So in the morning, I had made a list that before the first part, I will read these 1-2 pages and I will go, which I know I'm going to forget.
So you were reading on the day of exam also?
Yeah, I mean, like the night before and the morning, I woke up like 5-10 minutes. Just I went over like the most forgetful, the most volatile topics. I think not much, just like 1 or 2 pages of things that I had listed. So I thought that it would be divided, but it wasn't. So that strategy was useless, I would say, because first paper everything came from every subject. I don't know what was asked, and I didn't think first part was easy at all. First part was difficult because I was struggling with anatomy even before the exam, and I think this exam was very heavily anatomy based.
Yes, it was.
Many questions from anatomy were there. So I think first part was not easy, and PSM questions were there so many in the first part.
Yes.
So that was surprising too.
And what about part 2? What did you feel like after?
After first part was over, I was a little confident that okay, it was difficult, but it's doable. I can complete it. So I didn't focus much on the exam. I just went out, I ate something, and I came back. And I think second part was much easier for me.
Yeah.
Because in general, I don't like factual questions. I prefer to solve like clinical questions because you can always like. Yeah, there are more hints and you can always eliminate options. So I like those questions.
Part 1 also, I guess in part 1, there were a lot of anatomy questions as well as micro. Those were like, you have to be very careful. Even if I remember one of the questions regarding streptococci was there in the image was given of streptococci and the options were twisted. And after coming out of the exam hall, my neighbor was saying, I made this mistake, it was streptococci, and I didn't see the image, just directly marked something different. I was like, oh, then I came to know like, oh, I was little conscious during exam, so I did it correctly. How did you find ENT and Optha? Because ENT and Optha was like, oh man, I can't describe the word for it also.
ENT and Optha both were very difficult, but I think Optha was like too tough because even during preparation, I kind of found it very tough to study and to remember, and I had to read it like multiple times just to understand what is happening because it has too much physics and too much different concepts, and it is a little different from what you usually study in medicine. So I found Optha very difficult, and the questions were way too twisted. They were definitely not normal undergraduate level questions. 100% they took it from some specialty exam. Yeah, 100%. I think some questions might even be from USMLE also. You never know because
maybe. I still remember one question was there regarding there was eyeball given and all the muscles were pointed out. One big paragraph was given and they asked pointed toward this muscle or something. Explain the movement or mark the movement of this muscle. I said, really, you are expecting to answer me in 1 minute this question? Really? Like, because it took 2 minutes to read the question and then come to the options, and it was like 4 to 5 minutes were gone. So you have to skip these kind of questions. So that was really difficult.
For me, I had decided before the exam only that I will spend only 1 minute on one question. If I don't know in 1 minute, I will just review and move on to the next one, and I will do it at the end. And somehow, I don't know why, but I tend to finish exams very early. And even during
this I don't agree with you because I never finish them early. Like I at least I will like there will be little time left at the end, like for 10 minutes or 15 minutes nearby, but 30 minutes or 40 minutes I like this much time I don't believe that it will be left. I don't know about you, maybe you are exception or you have read a lot from USMLE that affected your mind maybe.
God knows, because I think even during my GT, I used to start giving GT and it used to end so fast that I used to think that what have I done? Like, am I doing something wrong? Is this like a wrong way to solve questions? But every GT would get over fast only, and I spoke to my friends and they're like, no, you are not doing good. some silly mistakes you will do during the exam, and this is not good. You should not finish the exam early.
No, it may be like it's practice. You have practiced a lot in last month, so that may be a reason.
Yeah, I solved a lot of questions from the QBank and even FMG solutions. I solved a lot of questions.
Yeah, but frankly speaking, I guess FMG solution is not that much worth it, because even if the question banks from this coaching classes, they have the same question, so no need to buy if you have subscription. But if you don't have subscription, then it's better to buy. I didn't have subscription, so I have to buy it, so I bought it. But still, bro, I think only clinical questions, or those who are asked in the past few years, those are only important. Not no need to solve each and every question.
I also didn't solve each and every question. I just solved like some questions from each topic, whatever topic I wanted. Like for example, medicine, I solved more questions because I knew that I watched only rapid revision of medicine, so I had to solve more and more questions for that. I think like clinical questions, it's more important to solve questions or to practice, because you understand like where the examiner is trying to catch you, right? And you understand the pattern. MCQ solving is like an art, and only when you practice it you will know. If you study only theory for 6 months, even if you have done it 10 times, you won't. I don't think you will be able to clear the exam, because you don't know how to solve MCQs. Learning how to eliminate options is very important too, because I think options only make the question more tougher. Because if the options are like really close to each other, then you find it more difficult to eliminate and choose one option. But if I can't eliminate even one, then obviously I have to guess it.
So next question is, we get a recall of questions after exam by several institutes, and what's your take on it? Because I personally felt it's a recall are never like they are not same, because in the exam hall, what situation, like what questions you are facing, those are completely different from the recall. So what's your take on it? So shall we depend on recalls every year, or just note a topic from that?
I think recalls, whatever students give, it doesn't match the actual exam, and at least that's what I personally thought, because the sentence is different, the grammar is different. And if it's like a really long question, then maybe you remember only 1 or 2 important points from that question. So that's what you go and tell the teachers. So I think recall,
it's just a made up thing, I guess.
Relying on recall, even like when people say that you should by heart PYQs and stuff, I don't think people should, because it's not the same question that will come ever again. If you rely on like by hearting the questions, then you're missing the point of actually practicing the questions properly and trying to figure out how to figure out the correct option. I must say that after the exam, I watched recalls a lot because I was stressed. So even though I thought they were not correct, I was still watching them out of compulsion because I couldn't stop myself. I was like, let's see what is coming, if I'm getting answers correct or no. Even though like so many recalls that I saw, I don't even remember that question on the exam. It's for something else only they were doing in recalls.
How did you manage your expenses at Crimea? Because as I know, Crimea is not in a great situation now, like because it has a war going on there, Ukraine and Russia, whatever things are going there. It's difficult. So do you think that it's a better option to pursue MBBS at Crimea in 2024?
I think after the war it changed a little bit more, because during the war there were much more stricter sanctions and forex cards stopped working in all of Russia, so not just Crimea. So some seniors and some other friends were doing cryptocurrency, and we would transfer money to their accounts and they would give us money to cryptocurrency by selling it. It was very stressful during the war, I would say, and especially when it started, you didn't know what was going to happen, because I remember when the first speech was made and the first announcement was made, there was panic among students and parents too. My parents were really worried at home, especially after seeing Indian news. On Indian news, on the first day only, they showed that Russia is going to put a nuclear bomb. So
Indian news is a crap, man. They always try to. They know better than what's happening there. Actually, they make up things a lot. Like I also getting every day. Like, are you living in a bunker or something? Like I was like, really? This.
Yeah, and news was crazy in India at that time, and that's what I guess made my parents more worried.
How did you manage your stress level during that time, or you were just like a chill guy like this only, or just ignored stuff?
It was very difficult managing studies and everything because everyone was very stressed. So I don't think I studied at all in like the first month that it happened. And I was just trying to focus on going to classes, eating food, coming back and sleeping. That was the only focus for like the first month because I was very stressed. And I think all students as well. And we had meetings with the team. And even though the university was very nice and they reassured us that, whatever happens, the university is there with you and you don't have to worry, you are safe. Things like that. But even after listening to those things, we were not feeling safe because of the news, I would say, with whatever we were watching online. So after a few days, I think after a few weeks, 2-3 weeks, I completely stopped watching the news.
Yeah, same.
I was like, whatever happens. I will stop watching the news. And I think as our semester was about to end as well, so 1 month before our semester was about to end, we decided to come back home because parents were really stressed and they wanted us to come back home.
Okay. So last question of the podcast is, any advice for upcoming FMG generation or FMG students studying there at Russia, as well as those who didn't pass the exam in their recent attempt, or those who are trying again and again and still they are not getting their desired marks? So what's your advice on that and what's your take?
So firstly, I think for the juniors, my advice would be, first of all, please don't skip Russian language classes. You have to learn Russian. And sometimes people think it's not important and why am I studying Russian? But even if you were in India, if you had to go to some other state, for example, if I want to go to Bengaluru or something, then I have to learn Kannada. If I'm in Maharashtra right now, so I have to go to the hospital and talk in Marathi, right? So it's the same with Russia. So if you really want to connect with patients and be able to talk to them without Google Translate, then please learn Russian as fast as you can. And in your clinical years, try to use it as much as possible. Wherever you go, try to ask for volunteer experiences. And if you know Russian, then it's much easier for you to learn. And teachers will also not hesitate to send you to different hospitals because they know you know Russian. Because most people speak only Russian in Russia, right? So that would be my first advice. Learn Russian. Second is that study for classes every day. Don't leave it till the last minute, or don't think you will start studying for FMG when you come back to India. Your preparation begins from your first year. If you want to clear it in a way that there is no stress for you. If you like stress, then go ahead and come back and study. But I think the easiest way is to study during university as much as you can. Do well in exams. Participate in extracurricular activities and enjoy a lot, and try to build yourself and become like an all-rounded individual. And for people who will be giving their exam in July, I think we have 2 months more to go. So practice as many questions as you can. At the end of the day, practicing questions is what's going to take you over the line. And identify what mistakes you made and be true to yourself. Like, for example, inside I know that I don't know a particular topic, but I'm just lying to myself and I'm thinking that okay, I'll just do rapid revision and get it over with. That won't work. If you think that you really don't know any subject or any topic, then please read it from the main videos or the main notes or whatever you are reading at least once, just so you get like a hang of it, and then move on to rapid revision. But right now, since there's no time, I think main would be focus on questions and give as many GTs as you can. I think 1 GT every Sunday is good. So by the exam time, you'll have like 7-8 GTs already.
4 to 5.
Yeah, that's.
So that was a podcast, guys, and it's a process, and everyone's process is different, and it was his process. And after doing this podcast, I came to know one thing, and I have learned one thing. That is, it's possible to crack this exam either ways, with subscription, without subscription, or by doing just rapid revisions. But there is a catch, that is, you should be studying your subjects from first year, so that your concepts will be cleared and it will be cakewalk for you. And at last, there's a message from him, so listen to it.
Just to add, I think I would like to say that you should know yourself and what you're comfortable with. Don't listen to what others are saying. If 100 people are saying that okay, you can't study before exam or whatever, but you think in your mind that okay, if I do this, I will be fine. Just listen to yourself and trust yourself. If you don't feel sleepy before the exam, if you stay awake at night also,
that's also normal. Yeah.
Don't be scared.
Yeah.
Because I couldn't sleep. I slept only for like 3-4 hours and I went for the exam. But I still wasn't stressed. I was like, okay, I don't sleep, it's fine. I mean, we are still young. One day we sleep less, it's fine.
Yeah.